Now I will be performing the safety wing butterfly needle. First, I will sanitize my hands and also ask for 2 identifiers from the patient. Then I'll remove the butterfly device from the package, and then I will stretch out the tubing slightly. Then I'll attach the vacuum tube onto here, twist it on. Make sure it's twisted really good to avoid any air leakage. And being that I don't have a tube holder, I will place it on a sanitized area. Now I'll apply the Torquet 3 or 4 inches from the elbow onto the patient's arm. Not too tight, as so. And then I will palpate the area to locate the vein with my index and ring finger. I'll ask the patient to ball his hand. It looks like right there. I'll mark it. I'll apply the alcohol wipe into the area where I will be inserting the needle, starting from the inner to the outer in a circular motion. And then I will allow it to dry. Now I will put my gloves on. I'll add the specimen tube in there, and I'll go in, push it up and out just to loosen it up. Sometimes it gets really tight, being that it's been in a package for maybe a couple of years. Now I'll begin to insert. I have found the vein that I've selected. I will stretch the skin back, and I will insert the needle, but I will hold the wing, holding up like this. I will insert the needle in a 10 to 15 degree angle, as so. There we go. And the blood is flowing through. Try to keep it steady. Looks like it's filling up. And as I continue to hold it, push in the tube. Make sure the blood flows in. Doing good. I will keep the tube and the holder in a downward position so that the tube can be filled from the bottom up. Then I will place, it looks like we done filled up the tube. I'll place a gauge where the needle was inserted, as so. Do not pressure down, and I'll take out the needle as I went in, as so. I put in the safety needle. This thing is difficult here. There we go. Safety needle up, and I'll put pressure on there. And while I ask the patient put pressure, continue to put pressure on here. Release it, shake it for about 5-6 times. And then I will label it with the patient name, date of birth, date, time, and my initials. And then I will put it in a biohazard bag to be transported. And then I will add a Band-Aid to the patient's arm as he continues to hold the gauge. There we go. Apply pressure, check on it. Looks good. Put the Band-Aid on it, and that completes the process.